Okay, so other considerations. So, young people with ABI are actually twice as likely to develop mood disorders such as anxiety and depression. Depression is about 8 times more common in the first year of traumatic brain injury, also known as TBI, than in the general population. So, as previously mentioned, many individuals self medicate to cope with ABI and often find themselves consuming alcohol. Now, using alcohol can cause depression or make it worse and has been known to have effects on their cognitive skills. So, how do we best support individuals facing ABI with dual diagnoses? So, I will be breaking up support in two parts: ABI in mental health and ABI in substance abuse. So, the best way to provide support is through therapies, rehabilitation, and interventions using trauma informed care approach. So, I really want to touch base on psychological therapies. Now, most common approach is through cognitive behavioral therapy, also known as CBT. Now, CBT can assist people who have experienced traumatic brain injury. Many people with TBI struggle with depression or anxiety, often because of fear of further injury or further loss of functioning. Now, in this situation, someone with brain injury might be anxious about getting hurt again. CBT would help identify this fear and teach healthier ways of thinking. Additionally, people with brain injuries also have anger management problems or more impulsivity. This is due to the changes in how our brain works after being injured. Now, CBT can teach someone ways to recognize this when it's occurring and give strategies to deal with them. Now, moving on to rehabilitation and interventions. Now, individuals who sustain brain injuries will begin acute rehabilitation straight away. So, the treatment is provided in a special unit of trauma hospital or a rehabilitation hospital. The second is education, really supporting young individuals and families with education about ABI, mental health, and dual diagnosis can really increase understanding and coping skills. Thirdly is mental health support. I think it's really important to refer the young persons to counseling and their family as well to cope with emotional impacts of ABI. And additionally, it provides access and resources for their own knowledge. And lastly, this is actually recommended by the Youth AOD Toolbox, which is behavioral management. So, it's really important to encourage the young person to participate in a program to assist with managing challenging behaviors and develop strategies for emotional regulation. Lastly is supporting young people with ABI, alcohol and drug use. So, through my research, I found that according to the Health Victoria, it's recommended that anyone working with ABI/AOD should provide support through the following. So, number one, identifying substance abuse is really important, to really understand the risk factors and the signs and monitoring usage over time. It's important for anyone that's working with young people to involve family and support networks in the assessment and treatment process. In addition, goal setting is really important, beneficial as well with the young person because they can really work together and achieve goals. Secondly, again, education, educating individuals and families about substance use risk, treatment options, and really emphasizing on prevention. Lastly, referrals, really assisting individuals in seeking treatment, addressing the effects of substance use on emotions and relationships, and really preparing for any relapses. Now, I'm going to pass you guys on to Nathan, who will be speaking more about services in Victoria that aim to help with anyone that is experiencing ABI, mental health, and substance abuse. Thank you.